everyone, and happy Friday. Well, all the women out there who are experiencing perimenopause and menopause, probably going through some pelvic pain or incontinence, very sensitive topics. We have never talked about this, and then we want to talk about this with Sarah. Sarah is joining me live from UK. She is a Pilates as well as a pelvic floor coach, helping women get over all these issues. Thank you so much, Sarah, for joining me.
Thank you. It's so lovely to be here, Amita. And the thing I love is that we're talking about it, because I don't know whether it's the same in America, but in the UK, women just don't talk about it, and they put up with these symptoms and they just feel all alone. They feel it's just them, when in fact, so many women suffer with pelvic floor issues. So it's really, really great to be here today.
Yeah, so let's just talk a little bit about the different type of issues that women go through. When one is you were talking about it, the pelvic pain, the other could be the incontinence. So talk to us a little bit with these two topics. We know other issues like hot flashes, but we want to focus on these two issues for this particular talk today.
Yeah, well, I've got a little sample of a pelvis here to show you, and in menopause, when our hormones dry up, our estrogen, our progesterone, our testosterone, as we all know, we get all sorts of symptoms. And one thing our pelvic floor loves is estrogen. And when we don't have estrogen, things can the muscles get a bit weaker. We also lose collagen as we get older. And collagen is a bit like, if you think of a trampoline that's all nice and bouncy, when it gets a bit old, it gets a bit brittle and it doesn't bounce quite so much. So when we lose collagen, we lose that bounce. So in women, we have this pelvic floor area here, which is a band of muscle that crisscrosses in the pelvis. And we've got a very wide area of bone. In men, they have a narrower area here because they don't have to push babies out of there. So we have this wide area and all this muscle that really isn't very well supported. So it's no wonder over time that these muscles start to weaken. And within this area, we have our anus, our vagina, and our urethra. So we have 3 exits. And the purpose of our pelvic floor is to stop things from coming out when we don't want them to, but to let them out when we do. And also to let things in with intercourse, with tampons. So these muscles need to be nice and strong, but they also need to be nice and flexible. And then attached to the pelvic floor, we have these deep abdominal muscles going out, which then attach to our diaphragm. So when we talk about pelvic floors, we don't just talk about this area here. We talk about this whole area that's connected to our breath, to our deep abdominal muscles. So over time, these muscles can get weak. And also over time, these muscles can sometimes get tight. And if you think of a muscle, so if you've got bicep muscles that are really nice and strong, and sorry, I should take my jumper off, but it's cold in England. If your muscles are tight and you walk around with your biceps holding them really tightly, they're just going to get weak. So to make those biceps strong, you have to do exercise and move it. And it's the same with our pelvic floor area. So often in menopause, it causes quite a lot of anxiety. Some of that anxiety comes from maybe not knowing what's going on, but also with those hormones, it can cause stress and anxiety then. So if you're anxious, you tighten. And actually, you don't just tighten up here. This pulls everything up and our pelvic floor area can get tight. And that's when these muscles can get weak because they're tight, they're over tight. Sometimes they get weak because just over time, the muscles have got weak, the collagen's reduced, the estrogen's reduced. And that's why we can have pelvic floor issues in menopause, but obviously throughout our life, women can have issues, but they do often come to a head at the time of menopause. Does that all make sense so far, Amita?
Yes, it does make sense. So I know I have to ask you this question because you are a Pilates instructor as well. And the next question is, this is what can women do? What can we do, right, to help ourselves? And we are just talking for another few minutes. This is a quick 10-minute session that we do, and just a small educational session.
Okay, what can women do? There is so much. This is muscle, and muscles, we can train them. So firstly, we need to learn to relax the muscles. So what can you do for yourself that helps you relax, whether it's meditation, whether it's exercise, getting out into nature. And once the muscles are relaxed, we can then strengthen them. So we can do exercises called Kegels, which we draw up inside. It's like if you squeeze up, as though you're trying to stop yourself passing wind, and you just squeeze up, you'll feel those muscles connecting. You must breathe while you're doing it. And those exercises can connect with that pelvic floor and strengthen it. But that's not the only thing. The main thing is to then be able to let go, because if you're just squeezing and squeezing and already your muscles are tight, you need to learn to let go. So we can put relaxation into our life. We can do exercises, but also movement. We've got 46 muscles attached to the pelvis. So by moving, by walking, by doing Pilates, doing yoga, we're lengthening the muscles. So they need to be strong, they need to be flexible, and they need to be able to relax. So treating them like any other band of muscle.
Okay. And then is there anything that, how often should we do the exercise? Like you talked about the yoga, the Pilates, and stretching these muscles, right? So do you recommend doing it on a daily basis, or should we do it and what is the duration of that exercise that you are recommending that we do?
Yeah, there's no really set answer to that, but we do need to, in life generally, be able to relax just as much as we can. If you can do Pilates 2 or 3 times a week, that is brilliant, or yoga, so you're stretching those muscles. The actual pelvic floor squeezes, because it is muscles do get tired. So you could just do about 10 or so at a time, just squeezing up and letting go, making sure you're breathing whilst you do it. So if you do that about 3 times a day, but always think more about the letting go than the squeezing. So you squeeze up, you don't hold your breath, you don't hunch your shoulders, and let go, and get really good at just getting a really nice deep contraction through those pelvic floor muscles.
All right. Well, thank you so much. Anything else you'd like to add? This is a quick snapshot of every illness that we bring. Anything else you'd like to add, Sarah?
Yeah, one more thing. So within this pelvic cavity, you've got your bowel, your bladder, and uterus. So if you've had a hysterectomy, you are more likely to have prolapse or pelvic floor issues, because they're all packed very tightly in there. So if you've had the uterus taken out, they've got more room to move around those organs. And a prolapse is when the organs just drop a little and they sort of move around. So if you've had a hysterectomy or you've had any pelvic surgery, then it really is important, extra important, to do these exercises and to strengthen.
All right. Well, thank you so much. We are bringing all this workshop to everyone within this month of April. So stay tuned. All these exercises that Sarah is talking about will be part of these programs and workshops, which we can do on a daily basis as women as we start aging, right? Mm-hmm. All of us, actually. We should start early on, not that when you're hitting the button over there, the red, the emergency button, then we say, oh, let me do these Kegels and all that, right?
Yeah.
Okay.
Absolutely. Never too early to start.
Absolutely. Thank you so much, and have a great weekend, everyone. And stay tuned and keep supporting us. Thank you so much, Sarah, for sharing your knowledge here. Namaste.
Thank you, Nita. Lovely to meet you.
Yes, absolutely. Thank you.